Do you have pain, burning sensation, numbness and tingling sensation in the lateral aspect of your thigh? Today we're going to be talking about Meralgia Perasthetica. Let's take a look here at this picture. We have the femoral nerve. It's a major nerve that supplies the leg above the knee and supplies the muscles. From the femoral nerve originates from the nerve roots L2, L3, L4. From it we have a branch, a sensory branch, is called the lateral femoral cutaneous nerve. Before it exits and supplies the skin, it exits underneath a ligament called the ilioinguinal ligament and supplies the skin in the lateral aspect of the thigh, predominantly over this area above the knee. So the cause of it, people who are overweight, they have an abdominal fold. The abdominal fold can compress the lateral femoral cutaneous nerve, giving us these symptoms. People who are skinny and they wear tight belt. Also the tight belt can compress the nerve at the level of the ilioinguinal ligament. Of course, you can have a disc at L2-3 also compressing the nerve, giving you the same symptoms. The symptoms, usually it's pain described as burning pain in the lateral aspect of the thigh associated with numbness and tingling sensation over that area. The symptoms are a lot worse when you stand or sit for a long period of time. It gets better if you lay down. However, if the cause of the symptoms is the disc, then the symptoms are a lot worse at night time when you lay down. The diagnosis is based on the clinical history and the clinical examination. So we get the history from the patient describing the symptoms, and on the examination, the patient will have decreased pinprick light touch and temperature over the lateral aspect of the thigh in the distribution of this nerve. If we suspect that the patient has a disc and is causing the problem, we might order an MRI of the lumbar spine showing us the disc. The treatment. If the patient is overweight, we ask him to lose weight. If they lose enough weight, then the symptoms will subside by themselves. If the patient is wearing a tight belt, we ask him to not wear the belt and to wear loose clothes, and that usually will help the symptoms. Sometimes we might use medications such as Cymbalta, Lyrica, gabapentin, amitriptyline, nortriptyline. However, those suppress the pain while you're taking, but if you stop them, then the symptoms come back. At that point, we might go to intervention with injections. We use ultrasound guided injections of either steroids with anesthetics or with platelet-rich plasma. Of course, if the patient, we confirm that the symptoms cause is a disc, then we go to treat the disc with either decompression, epidurals, or even surgical intervention. And thank you.